Hello everyone, it's Eric from Strong Medicine. It's that time of year again, that is the first month of work for new interns in the US. If this is you, congratulations. Completing medical school was a huge accomplishment, but there is more to do and to learn. Internship is not easy. I'm sure you know that, or at least have been told that. However, I'd like to give you some tips on how to make the next year go as smoothly as possible. These 10 tips are inspired by the mistakes that I made and the most frequent mistakes that I've seen subsequent interns make over the years. Regardless of whether you are talking to your resident, an attending, a nurse, or a patient, it's always okay to respond to a question with "I don't know," but it's even better to respond with "I don't know, but I will find out." There is no shame in not knowing everything, and there is no excuse for relying on an educated guess in a situation requiring certainty. Never speak disrespectfully of patients. Not in private, not among colleagues, not with patient information anonymized, not ever. I certainly get why this happens. Patients can be frustrating, they can be rude, they can disregard your recommendations. They can imply that you are not a real doctor because you're young, or because you're a woman, or because you're just an intern. But remember that people are at their worst when they are sick and in pain and frightened and not in control. And it is your responsibility to provide them the greatest possible care that you can, irrespective of how they are treating you. If you begin to dehumanize them with insults and inappropriate language, even behind closed doors, your ability to do that will be compromised. It's absolutely okay to discuss your frustrations with colleagues when dealing with a challenging patient or family, but always do so respectfully. If you think you might need help, you probably do, so ask for it. And if you don't think you need help, you still might. Be aware of cognitive biases when developing your differential diagnoses. Don't focus on just one salient feature, known as anchoring bias. Don't accept another doc's diagnosis at face value, known as momentum bias. And don't only pay attention to data that supports your hypothesis while ignoring that which refutes it, known as confirmation bias. And if your med school is like most, and you did not receive any specific training in cognitive bias, take an hour or so to read about it. I posted some helpful journal articles in the video description. Never use "the patient doesn't look sick enough to have such and such diagnosis" as the primary reason for ruling that diagnosis out. Of all the cognitive biases that are out there, this is one of the most problematic for doctors, yet is almost never discussed. So for example, don't say that someone can't have cardiac tamponade because their blood pressure is normal, or that a patient can't have a staph pneumonia because their chest x-ray doesn't look that bad, or that a patient can't have appendicitis on the sole basis of they appearing to be comfortable on the ER gurney. Even the most acute and life-threatening problems start small, and the bodies of different patients respond differently to massive physiologic perturbations. How a patient looks overall and vital sign stability should certainly play a role in the clinical reasoning process, but only as one piece of data analyzed among many others. Be open-minded about all feedback you receive. While not every piece of feedback will be helpful or accurate, even your harshest critic wants you to become a better doctor. When calling consults, try to have specific questions for them. But if there isn't one or two specific questions, it's okay to summarize the reason for the consult as, "I don't have a specific question, but I need your help to figure out how I can best care for my patient." These consults can be frustrating and time-consuming to field from the consultant's point of view, and sometimes a remote chart review of the patient will suffice. But any consultant that gives you a hard time in response to such a request is acting unprofessionally. There will be times in which a patient will have problems that fall so far outside your specialty or area of expertise that you may not even know the right questions to ask. Those may be the times that you need a consultant's help the most. Depression among interns is common, particularly in the first couple of months. If you feel overwhelmed or burned out, you are not alone, and you should seek out help, or at the very least, someone to confide in. No one should try to go through internship on their own. All of your co-interns are facing similar struggles as you. They are there to support you as you would support them. When talking to patients, sit down whenever possible. It helps with establishing rapport, and it gives the impression to patients that you are spending more time with them than if you were standing. The difference between needing 1 LP attempt or 5 is usually getting the patient properly positioned. That holds true for all procedures, but particularly for LPs. Finally, a bonus tip, largely because I could not narrow my list down from 11 to 10. Remember that every patient has something to teach you. Being a great doctor is rarely about diagnosing enigmatic diseases or making life-saving split-second decisions. It is more important to develop empathy and effective communication and teamwork skills. Mastery of those, rather than textbook knowledge or even skill with a scalpel, will be more likely to make a difference in someone's life. So no matter how seemingly mundane the problem at hand might be, approach every patient encounter as an opportunity to become a more effective communicator. And no one ever has become an outstanding doctor from sitting in front of a computer. Your patient should be your primary resource for learning, not PubMed, UpToDate, and definitely not Wikipedia. So that's it. Those are my 10 or 11 tips for new docs. I hope you found them to be helpful this year. If you have any of your own tips, please share them in the comments below, and good luck.